Okay, it's 2 minutes past. We'll get started. Um, Thank you all for coming today. We have a really interesting session lined up. So we'll go through the agenda. We'll do welcome and introductions. Welcome everybody. We'll give an overview of the key messages. This week we have an update from our Young Adults COVID Champions network, which is brilliant. We've got Toby join us this afternoon. We have Champions Corner as usual. So this is led by you champions, and it's a space for open discussion and to raise any comments, suggestions, and ask any questions that you have. Our theme today is an insight into working on the front line during COVID-19, and we have Dr. Mohan join us today. So he'll be able to give us an overview of his experience, and we'll have time for questions and discussion. We'll go through our next steps and we'll finish by 1 p.m. So I've seen we've already started doing introductions in the group chat, which is great. Thank you, everyone. Welcome to any new champions joining us this afternoon. Any new champions, if you haven't already seen, we start off the session with people introducing themselves. So you're more than welcome to use the chat box throughout the session as well, to ask any questions or make any comments. Just a little bit of housekeeping. You can choose to have your camera on or off, but we do ask that when you're not speaking that you mute yourself so that we don't have any feedback. And now I'm going to hand you over to Barry, who's going to go through the key messages. Barry, you're on mute.
Sorry, champions. What I said was hello again. I hope you're all well. So key messages this week. Again, some positive news that the 7-day rate within the borough has continued to decrease. So in the most recent reporting period, the 7-day rate per 100,000 had reduced from 827 to 617, which is really positive. You know, we're not getting too excited about these movements, but they are going in the right direction. They are coming down slowly. The over 60s rate, and if you will remember that this is a rate that we look at particularly closely because these over 60s are particularly vulnerable. So what we are seeing is that rate is also reducing over the recent reporting period. What I will say is that I've looked at the most recent data, so from yesterday, and the 7-day rate is at 534. So again, the rates are coming down. They're coming down slowly, but they are still very, very high. And we are still seeing higher rates in East Merton. And that's a real area of concern for us. And we're working to look at the data on age groups, so we can understand what that means. Some initial hypothesis, some initial thoughts around that are perhaps some of our residents in the East are unable to work at home whilst they are in the West. Again, it's an ongoing piece of work for our health intelligence team. What I will say is that last night there was a Merton Health and Wellbeing Board, and Dr. Dagmar Zuna, our Director of Public Health, went into gave an overview of the SITREP, so the latest data that's available. That's really helpful to give you an overview on lots of data, because I know as champions you're really keen to see and hear about the data. We will share the link with you. I think it's a really interesting insight. I know that Councillor Una and Mohan were on that meeting. It was a very, very, very positive meeting. I was watching on YouTube last night, but we will share that because I know champions will want to look at the data. Key messages around is that perhaps some positive news that admissions are starting to level off. That doesn't mean they're reducing significantly, and our NHS is under significant pressure. There are a large number of inpatients and people in intensive care, and we expect that will continue, unfortunately, over the next few weeks. So again, that key message really is to continue to stay at home and protect the NHS. You will remember that I spoke last week that in the most recent reporting period there had been 33 deaths of Merton residents. This week there's been 32. So again, we're not seeing huge increases, but that is still high, and it's incredibly concerning. So we need to protect the NHS and stay home where we can. So cases are decreasing, but testing rates have also reduced as well. So again, champions, you've heard me say this many, many times, but this is really important message. Anybody with symptoms, even mild, should self-isolate immediately and get a test via the website or via 111. And again, it's really important not to attend our asymptomatic, our lateral flow testing sites if you have any symptoms. What I can say again, we've been speaking about the LFTs and the potential for them to support frontline workers for a while, champions. So last week there were just under 3,000 LFTs taking place within Merton. That's fantastic, and we want to encourage frontline workers, carers and volunteers to continue to take part in that asymptomatic testing program. There is no walk-up testing, so all tests must continue to be booked via the council website. And again, I'm having an increasing number of conversations with different settings. So again, having conversations with voluntary sector providers, businesses, and early years. So on Friday, I had a webinar with 29 nurseries who were interested in providing the LFTs for their staff as well. Vaccination is continuing. We've had lots of questions. We had Vassar a few weeks ago, and I know that Mohan has been working amazingly on the front line with many of his colleagues and volunteers to increase the numbers of vaccinations in Merton. Just that recap that the vaccine prevents serious COVID, but the studies about preventing or reducing transmission are kind of underway now. So it's really important that we continue to follow those non-pharmaceutical interventions, hands, face and space, even when you've had the vaccination. We're working really, really hard across the NHS, the council, and with our communities and organisations to really understand the barriers to vaccination. Intentionally not using the phrase vaccine hesitancy, actually, because there are barriers, and there are some barriers we need to remove. It's not just about the individual, but there's some operational things that we can do as well. We need to listen. We need to not to jump to any conclusions, and we really need to build trust. And I see a really important role for our champions to have in that piece of work. And so I'm sure that we will, in the coming weeks, we will be coming with you with plans, thoughts, approaches, because that'd be valuable. Really appreciate your input as well. Final key message, and I've been mumbling on for a while now. You would have seen the announcement on Friday by Boris about the potential severity of illness from the new variants, so Kent, South Africa and Brazil. These are being researched right now. So at this stage, the evidence is not sufficient to draw any conclusions on severity. But what we do know, and we spoke about before, is about those new variants, such as the Kent one, to be more transmissible. So hands, face and space, the same message we've been talking about since September the 23rd when we first met. They do help prevent infections, but it's really important to be extra vigilant. I guess the final point on that is that you will have seen in the press today, champions, I know you're well read and you look at the news and you read the research articles. We're expecting an announcement today on potential quarantine of hotels, hotel quarantine for visitors from certain places across the world. We'll see what that announcement makes. But it was really interesting picking it up in the press, because you asked us last week, how are we managing quarantine when people are visiting our country from other places? So let's see what that comes out with today, and we'll be able to pick up any of those questions next time. So I will hand back over to Una.
Thanks, Barry. So I'm going to bring in Toby from the Young Adults Community Champions. Toby's a young inspector, and he's going to give an update on the Young Champions Network, and also to ask anyone that would like to get involved if they can. So Toby, over to you.
Thank you, Una. Hi, yeah, I'm Toby. I'm a young inspector. So the young inspectors have been coordinating the Young Adults COVID-19 Community Champions group. This has been really successful so far. We've got our third session tonight. this group is mainly about promoting promoting Merton's response to COVID and giving people information on Merton's response to COVID. So we open to members of the public, members from all sorts of different organisations in Merton. We do open to people outside Merton, but to become a member, you do need to be either a resident or work in Merton. We've had some really good numbers so far. As I say, we're having another session tonight. So I definitely, as Una said, I'd welcome anyone else who would like to get involved. We'd love to have anyone else because it's all about how organisations can provide insights to both the council and Hi, so can anyone hear any of that?
Hi, Toby. Yep, we can hear you. Toby, you've gone on mute, but we could hear you.
Oh, sorry. Okay, it popped up and it said I have been muted. So no worries. Yeah. So that's basically the update. Yeah. So we're on our third session. We are also going to be launching our under-18s COVID-19 Community Champions group soon. We're working with the Education Department in Merton because obviously schools aren't open at the moment to all children. They're only open for key worker children and vulnerable children who are vulnerable. But we are aiming to set that up as soon as we can. We're going to be providing fortnightly videos for children under 18 and parents and teachers, which will give information about testing in the borough and why it's important to get a test, what is the difference between the types of testing, and sort of a more a general overview again of Merton's response to COVID, obviously tailored for children under 18 and not sort of young adults. But yeah, that's pretty much the overview from me. So yeah, back to you, Una. Thank you very much.
Thanks, Toby. Is the fortnightly videos that you're doing, are they being led by parents, or would you like parents to get involved? Or any way that our champions can help out with that?
Absolutely. With all of this, the more involvement from anyone, the better. We want as many people involved as possible. The plan to have parents as part of the under 18s group has always been the case. We've always wanted parents to be involved, and that nothing's changed there. So we'd welcome involvement from parents. Like I said, this is still kind of in the developmental procedure at the moment. But we'd love any parents to get involved. I'll leave my email in the chat, but obviously, but you could also, anyone can also contact Una. But we'd welcome any involvement from parents or teachers or governors, or we're trying to get involved with everyone in the school that we possibly can.
That's great. Thank you, Toby. And like Toby said, if anyone would like to get involved, you can ping myself an email, and Toby will leave his email address as well. And Barry just put a comment in the chat box that the resource we shared last week on the difference between the LFT tests and the PCRs was developed by the Young Adults Champions. So that was really, really helpful, and we've had a lot of great feedback on that. So thank you, Toby.
No worries.
So now we're at Champions Corner. Does anyone have any comments or questions, any suggestions for the network following our session last week? Lisa, your hand is up.
Yeah, thank you. Just a quick question. One of my colleagues couldn't make the meeting today, but she said she's having her COVID vaccination tomorrow. But she has been advised that if she goes to take the LFT, the lateral flow test, after, then it's going to produce a false positive. I was just wondering if that is true, and if it is, what sort of period she would have to wait after the vaccine before an accurate lateral flow test result.
That's a really good question. Thanks, Lisa.
Lisa, I haven't heard that before, but let me look into that and confirm with you. I know that it's when you get an LFT and a PCR, but I haven't heard that a vaccination produces a positive or return or false positive on an LFT.
That'd
Anyway,
be brilliant. Thank you, guys.
I can see Mohan. I can see you've got your hand up. Did you have anything else to add on to that, or was it a separate point?
Yeah, no, it was probably to add on to that, really. So the LFTs will be a nice sort of asymptomatic test to find patients who may be COVID positive. If it is a false positive, then you'd still need to do a PCR test to confirm that. And so it just gives you that first possibility of it being positive. So you'd still need to go and do an official one. So whether it actually does or not, I agree, Barry. I've not heard of that being the case, but it's always worth confirming.
Yeah, we will double check that and get back to you. Thanks, Mohan. That's incredibly helpful. And the process has recently changed on LFTs that in the community sites you do not require a confirmation PCR test. But we can pick that up. But Lisa, a really good question. We'll pick that up for you.
Thank you both. Sarah, your hand is up.
Hello, hi. Just a quick one. Mostly Barry, I think, and this is a centralised issue, but maybe you can help get it there. The 119 number puts you through to obviously a first port call, and they were unable to provide information to a friend of mine who required assistance during a test. Please would you try and get the message to the centralised system that in that case, any assistance to administer a test, you come in your GP and get one of the nurses to come out and visit you. They were unable to provide that advice. They didn't know how to deal with it. So please would you try and get that message to centralised 119. Thank you.
Sarah, thank you. I will do that. As you know, we through our Director of Public Health, we do have opportunity to feed back into the region and the national teams. I will raise that accessibility. And Sarah, so was it specifically around support to do the swabbing of a PCR test?
Yes.
Thank you, Sarah. Leave that with me. I will raise that for you.
Yes.
Thank you, Sarah. Andrew, your hand is up.
Yes, thank you. I just wanted to follow up on the point of LFT. When welcoming staff who have been off with COVID back to work, I'm thinking about them rejoining the LFT testing. Am I right in thinking that they would produce a false positive for a while, even though they've gone through the isolation period and feel well and have recovered?
Okay, thank you, Andrew. Good question. So what the LFTs are really good at is identifying those asymptomatic people with a high viral load. That's what one of the positives from them. The process and the procedures that's in place is that once isolation has completed, so once that 10 days is over, or 14 for a care home resident, then people are able to continue to restart their LFT use. But what we can do, I know that Andrew, we're working on this with yourselves as well, but that's the guidance, that it shouldn't be picking up those or setting a false positive. But I can send out some clarification out for you.
That's great, Barry. So I'm clear. If a member of staff comes back to work for us who've gone through their isolation period, excuse me, and then they rejoin the LFT testing schedule that we have for staff now. If they do test positive, we take that seriously, and they should go and get a normal test in the same way.
Yes. So if a positive comes back from 7:20 a.m. this morning, an LFT in the community program does not require a confirmation PCR test. So if you were to do an LFT today and that came back positive, the text message you will get from Test and Trace will say it is likely you had the virus when you took the test. You now have a legal duty from now to self-isolate. So there's no requirement for a PCR confirmation. So you're right there. What happens in a PCR test, if you remember those gold standard tests, is that sometimes those PCR tests can pick up the kind of fragments of the virus for up to 90 days after ish. So that's where the difference is. But yes, once you've completed the self-isolation period from being a positive case and you return to your workplace, as long as you are well, you can restart the use of those LFTs.
Thanks, Andrew. Thanks, Barry.
Thank you. Thanks, Barry.
Sarah, your hand is up. Is that a legacy hand or is it a new hand?
Oh, sorry. Yeah, that's right.
No, that's fine. Just checking. Emma, your hand is up.
Hello. I just wondered, does anyone know how accurate the lateral flow test results are in that case? I'm going to be taking my first one today, and obviously we're taking 2 a week at Age UK, asymptomatic, to reduce the risk. Really, it's not that we have symptoms, but it's just that so that before we're going into a home visit, we know that we've got a negative result. So I'm a little bit worried now that they're not going to be accurate. So it's kind of, I don't really want to go through that twice a week and still not having an accurate result. Sorry, would you mind just clarifying that? Is that okay?
Yeah, Emma, thank you. Firstly, thank you to Age UK and yourselves for taking this asymptomatic program really seriously. It is appreciated. So the purpose that we are using the LFTs is test to find. So this is about identifying and finding those people that are asymptomatic. So they're shedding the virus, they are infectious, but they don't know it. And so for a test to find purpose, the LFTs are perhaps around 50 to 60% accurate. Okay, but if you remember why we're doing this is a positive step. And again, what we can do, the purpose of it is to identify those that are asymptomatic. Even if we find 50% of people that are asymptomatic and take them out, so they have to isolate, that's a positive news story for us. It helps break the chain of transmission. Sorry. The other way we overcome that potential area of concern about the LFT sensitivity is by encouraging regular use. So that's why we're suggesting twice a week. So again, that overcomes some of that limitation around the sensitivity of the test. Does that help, Emma? But by taking part in the program, you are doing a fantastic thing. It's really positive. It's helping keep you and the people that you are looking after safe.
Thank you.
Thanks, Emma. Maria, you see your hand is up as well.
Oh, hi there, Una. I was just getting back because I'd asked that very same question about the lateral flow last week to my manager, and he gave us speak to us today in the team meeting, and he said they're settling on 58%. So you're spot on there, Barry. I think it was between 13 and 17, but 58%. Obviously, it depends on the accuracy of the person taking the test themselves, because they do it themselves. So they need to get to the right spots. So yeah, follow the guidance. And I think a gag instinct is quite a clear indication that you've got it right.
Thanks, Maria. And just to come back on that, I kind of see Andrew's put the note in the chat as well. So it's absolutely clear. So from today, those LFTs through the community testing route. So if you go to a community pharmacy, if you go to more than assembly halls, or if you're part of our devolved model, so working with Age UK, for example, there is no requirement for a confirmation PCR test. Those people that are conducting LFTs at home, so many of the NHS workers, our primary school teachers, will require a PCR test. So again, you will be given clear information on how you access your LFT about what the next steps are. But yes, Andrew, if you go to our community pharmacies at modern assembly halls, you do not require a PCR for verification of that positive case. The legal duty started today to isolate immediately.
Thanks, Barry. I'm just going to bring in a man who is going to answer some questions that we had from last week on the vaccine. Man, are you there? You are.
Thanks, Una. I'm also going to bring Ben in as well. Ben and I are going to try and address some of these questions. So Ben, please feel free to chip in. I think I heard Barry say Mohan was also on the call. So Mohan, if you'd like to add anything, do chip in as well. So we had a question about calls coming into the Nelson regarding attending vaccination sites last minute. I can't give you a clear line on that today, I'm afraid. We are following up on that, and I can assure you that when we do have the correct messaging, we can. I'll definitely relay that through Barry and Una, so you can get that as soon as possible. There was a question on the clarity of the process when you receive 2 invites. So some people have been receiving 2 invites, and it is possible that you may receive 2 invites. You could receive an invite from the mass vaccination site, or you could receive an invite by your local GP. It's up to you which invite you choose to accept, and then you can follow up with the process. It's detailed within the letter. We have had questions about people who get 2 invites and have booked both appointments, and this is to try and get around the 12-week wait, but it does get flagged. So when you book your first appointment and you've had the jab, it gets recorded on a system. So if you then go to the second appointment, which is followed up from the other invites, then it gets flagged. So they'll know if you've had your jab recently and if it's not within the 12-week wait. So it's really important to have your jabs with the same vaccination centre or the same local site that you've had the first jab at. Hopefully that's clear. And there was also a question around carers getting vaccinated. So at the moment, the NHS is only allowed to vaccinate in priorities 1 to 4. We don't know when, but we do expect there'll be some loosening of the criteria to come over the next month or so, but this is a nationally set agenda. On an operational level, some vaccinators will use their discretion and vaccinate outside of the criteria, so they could move down the cohorts, for example, to cohort 6, which includes carers, where there may be concerns, for example, about vaccine wastage. But just to emphasise, at the moment, we're only allowed to vaccinate the priorities, which is cohorts 1 to 4. Dr. Mohan or Ben, did you want to add anything to that? Or hopefully that's cleared up all the questions we had from the last session outstanding.
No, nothing for me.
I mean, I can add something about the vaccinations at the hub site. So certainly when you open up the Pfizer vaccine in particular, you've got 3 days to finish the vaccines. And so lots of patients have been booked in to get the vaccine. So certainly if there is some left over at the end of the day, we need to make sure we utilise them and don't waste it. So there are lists of a reserved list, I should say, of patients who are eligible for having the vaccine, who do get contacted later on the day to get their vaccine. So that's probably what that query was, the first one you had. But the other bits, yes, definitely, that's what the stance is. Thank you.
Thank you. And I think that was all the questions, Una.
Perfect. Thank you both. Do we have any more questions or comments before we leave Champions Corner? Nope. Okay. Well, I'll hand it back over to Dr. Mohan to talk about his experience of working on the front line during the pandemic.
Thank you, Una, and good afternoon, everyone. It's good to be here and happy to talk a bit about sort of some of the experiences we've all been facing, and it's been very unprecedented times for all of us. And I, we go back to almost a year ago from wave 1. Certainly, primary care had to adapt, as we all did, and certainly around then we were doing about 25% of our calls on the phone, but now that's changed to 95%, obviously because of COVID, and we need to make sure that patients aren't exhibiting COVID symptoms or coming to the practice where there might be vulnerable patients. So that's probably the first change, and also we've also needed to adapt in terms of carrying on with normal primary care related work. That doesn't stop. People still continue to get unwell, and so we need to ensure that we support the patients who have COVID symptoms and those who have non-COVID symptoms and have urgent requirements as well. So it's getting that messaging across that we are still open for business, although it's not business, but we are open to support patients in our community, and navigating that has been we've managed that very well, and certainly we've been collaborating with the council, with the voluntary sector, with all our connections, and that's been really telling. We've continued with our immunisations, we've continued with screening, and again it's paramount that we continue these support. We continue to screen patients as much as we can. We've worked as primary care networks, so a lot of practices are working together more closely, again with the flu vaccination, and now with COVID vaccinations as well. Everyone is supporting each other to try and get this done as quickly and as fast and as efficiently as we can. Merton's in a good place for that, and it's boding well for the next few weeks, few months as well. Just touch briefly on COVID. The vaccinations, again, a great collaborative effort. We had the Army in over the weekend, which was great. Everyone loved the Army coming in, not just the patients, but also staff as well. And that was a real benefit. That really managed to get lots of patients vaccinated, and also gave a big morale boost for all the staff involved. There's lots of other schemes going on. So we're with COVID, it obviously reduced your oxygen levels. And so when it gets to that, when your oxygen levels go low, that's maybe when you need to go to hospital. So we come out with schemes to try and support that, where we're able to give out oxygen measuring devices to the community, so we can measure you at home rather than going to hospital. So that's a really sort of a good scheme, which has prevented hospital admission. The hospitals are quite busy at the moment, certainly with the rise in a number of cases of COVID. So we're trying to adapt and support them as much as we can out in the community. Care homes are being vaccinated, and we've got a good number of care homes being vaccinated. Volunteers have been great as well. We've had a huge response from patients, from volunteers in Merton who have been helping out with the vaccination hubs and other supporting mechanisms. So I want to thank you all actually for doing that. And so it's been a challenging time, but I think everyone has come together to support the drive. One question I did want to ask was I wanted to share a slide, if I may. It's looking at the different the waves of a pandemic, and we're looking very much at the medical or physical implications of COVID, and so can you see that? Is that showing on the is my graph showing up on your screen?
Yeah, we can see that.
Yeah, great. So it's quite a busy graph, but we've got 4 waves here. So we've got the first wave here. It's a bit blurry, and that's the kind of immediate impact of a pandemic. And they're the patients who need hospital admissions, end up in ITU, and after a while, that sort of reduces down. And then the second wave, which comes in, which is a green line, is this sort of slight the long COVID, or patients who are recovering from their COVID symptoms, and obviously you've got your third wave where patients have not seen or felt that their health conditions not needing urgent requirement, and so they start coming into the foreplay. But I want to bring your attention to this big red curve, this semicircular curve, which is looking at mental health, and certainly as we're being locked up or practicing social distancing, it's not sort of natural for us to do this, and certainly we're having to adapt. We're social animals, and so that's going to have a huge impact for many months, many years to come. And so as community champions, it would be nice to sort of see how we can support each other, not just in primary care, but also in our community, to kind of develop this further, because I think we're starting to see a big impact of this already from the first COVID wave, which happened in March, April last year, but also the implications of the ones happening now. So I kind of want to leave that graphic on there and just sort of highlight that as being something we're going to face more of in the next sort of few weeks, few months. I'm going to stop sharing that. And that was all I kind of wanted to say, really. So I'm happy to take any questions or support in any way. Thank you.
Logie, I see your hand is up. Have you got a question?
Yeah, Mohan, you just mentioned about this oxygen level. I was in the hospital on 30th of December, and I come back and I had this oxygen meter. Today, it's been fluctuating between 90 to 95. It doesn't go any more than that. Is there any problem there?
So I think certainly, we have to get the levels and certainly assess that alongside your clinical situation, how you're feeling yourself.
I'm fine. It's just that keep people saying it should be more than 95, but it doesn't seem to be going at. Sometimes go 96, then drops down between 90 and 95.
So I think the intervention is if it goes below 92, then we need to consider whether hospital admission is required. And the reason being of a condition called silent hypoxia, where patients may appear quite well, but actually their oxygen levels are very low inside them, and they need treatment. So if you're at the 95 level, then we'd be happy with that, and I think it's better to treat you outside hospital than in it.
Yeah, even now this peak flow meter is just getting nowhere near 400. I get about 350. That's so much.
Mohan, can I just correct me if I'm wrong, that if any individuals have any clinical needs, they should speak to their GP?
Yes, of course. I think certainly if there's every case needs to be assessed on its own merits. So yes, completely echo that.
Thank you.
Thanks, Logie. Thanks, Mohan. Sarah, your hand is up.
Hi again. Just to reiterate, really, my support group is still going weekly, and that's a community peer-to-peer led group which I facilitate for maintaining well-being and mental health online. So anyone's welcome, and I'll put details in the chat box. Cool.
Sarah, as we've kind of developed a new agenda, and you've heard from Toby a little bit earlier about a 5-minute session, perhaps in one of our future champions meetings, you'll be able to take up those 5 minutes to take us through a little bit more about what you do and how you do it.
Cool. I just want to mention in Mohan's chat about community outreach. So yeah, but I'll be happy to do that. Yeah, cool. Cheers.
Thanks, Sarah. Does anyone else any questions? Just check if anyone's hands are up. Lorna, your hand is up. Oh, you're on mute, Lorna.
Off mute. Question for Mohan. Lorna Cohen from Wimbledon Guild. How do you advise some of our customers, some of whom were at the Wilson, some I think at St George's, some have been given a date for their second and some haven't?
Sorry, what was the question?
How would we advise our customers, some of whom have had their first vaccination, some have got a date on their cards for the second vaccination, and some haven't?
It's a tricky one, really. I mean, we've been advised that we shouldn't be giving the second vaccination. Certainly, we're not. Well, not that we shouldn't be giving it, but it should be advised to giving that after 12 weeks. And so we've not quite reached the 12-week mark yet, because we only started them in December the 14th. So that 12-week mark would hit in January, February, March, middle of March. So, what we're encouraging is patients to have their first vaccine, which is what we're targeting at the moment. So I don't know if that answered your question, but if they've got a second date.
Really? No, it doesn't, because what do we tell our customers? Some of whom they turn around and say, well, she's got it or he's got it and I haven't. So I just pretending not to hear.
Well, I suppose the guidance changed. So certainly when it first came out was that in December 15th, it was that actually we should be giving our second vaccines within 3 weeks. Now, halfway through December or towards the end of December, that guidance changed, which you're probably aware of. And so some people did get their second vaccine, whereas others have said, look, I'm sorry that the guidance has changed and therefore we need to wait for 12 weeks. So that's what I've been telling patients, and that's probably what you need to tell them as well. It's not, that's what we've been told from national. We can't make those rules up.
No, I understand that. Thank you.
Sorry, everyone, I was on mute. Sarah, your hand is up. Is that a legacy hand?
Sorry again.
Yeah. I think Sue, you were next.
Hi. Yes, it's just I would put a message in the chat, but it's gone a bit further back now. I just wanted to check. I just want to say, firstly, actually, when we got our first vaccine, we were all given a date for the second one as we booked by the booking system. So that we have got a date, but it's 11 weeks from the first date. And I know it's probably too early to say, but I just wondered in terms of medical information. As a team, we were talking yesterday about the implications of the current news issue with exporting Pfizer vaccines, you know, whether there's going to be an issue about whether they can be exported. So did anyone know if the second booster doses, for which we've been given dates in April, will already have been allocated from current supplies, or will they be reliant on new imports nearer the time?
Really good question. It's probably a little bit early to say, as you said in the chat. You know, we're kind of still understanding if there are any supply problems to the vaccine and the different types of vaccine. So it's probably something that we need to keep a close eye on, and we'll communicate that. Particularly with our NHS colleagues, if there are any changing of the those second doses. Is that okay for now?
Yes, okay, thank you. I mean,
also,
I thought it was probably that, but I just didn't know if they might have allocated some back for ones that were already booked, you know.
Yeah, it's probably a little bit early. But I want to come back on the second point around when and where do I get the second vaccine. So what I've got in front of me is the FAQs from the NHS, and we can send the link on this to the champions, which goes to the Merton NHS website. And so what this says is that once you've had your first dose, you need to come back to the same place for your second vaccine. If this is at a local GP-led centre or hospital, you will be contacted to book your second appointment nearer the time, which will be up to 12 weeks later. If you've received your first vaccination at a large vaccination centre, then you'll have it booked your second appointment at the time of booking the first. So that's the difference in the booking process for those second doses. But again, we can send that out with the notes on Friday, so you're able to advise and support your colleagues as best as you possibly can.
I was on mute again, sorry. Thank you, Barry. Marcella, I saw your hand was up. Did you have a question?
No, I just wanted to sorry. Yeah, I just wanted to emphasize again of the the problems with people's mental health issues, and that my experience, I mean, not only with carers but also with people with mental health issues directly, that it is really coming to a point where people are really struggling, and so it is really important, to keep connected, and with our auntie, for example, we had a project, a telephone support project. It's just sometimes to keep in touch with people, and that people know that there's someone at the other end, and not everyone has family or a lot of friends, and people can get very isolated. I mean, I know it from myself. I live on my own, so it can happen that you spend maybe days without, I don't see anyone, and so it's really important that you keep these the connections, that people don't fall through the net, so to speak, that goes very, very quickly.
Oh, thank you, Marcella. That's a really good point. Yeah, and what we do have in 2 weeks' time, on the 10th of February, we're going to have Merton Uplift, attend our drop-in session and speak to us about mental health and their experiences during the pandemic, and tips and advice on what to do and where we can go if we need support. So I'll update you further on that, but they are booked in on the 10th.
Okay, thank you.
Serene, your hand is up.
Yes, thank you, Una. I just want to mention while we are talking about mental health that when Merton has introduced new sessions about mental health awareness, we have training and session, and we are already doing that with many organizations. So whoever will be interested will be happy to introduce the mental health awareness to the group. Thank you.
That's excellent. Thank you, Serene. If anyone would like to get in touch with Serene, pop me an email and I'll liaise between the two as well. So thank you for that. Someone else's hand. Barry, your hand's up.
Yeah, thank you. And I was just going to come up. So Kemi's asked a question on the chat. Is there a role for community physios to help with breathing exercises and advice to improve coping with COVID? If you remember, what we spoke about before was better health, Merton. And so those small changes that we can do to prevent the risk of severe COVID, such as stop smoking, lose weight, manage your long-term conditions. So there are definitely things that we can do to prevent that severe COVID taking place. Una's working incredibly hard on to get those messages out, but we can share that information again with you. It's really important that as we're starting to think about recovery and supporting health and well-being, and not just talking about COVID, and you know, we've got Mohan, a local GP there as well, that we start thinking about those health improvement changes that we can make, so we can share that with you champions on Friday.
Thanks, Barry. Yep, we will share that. Does anyone have any other questions? Sarah, your hand is up. Is that a legacy hand? Serena's.
Just one thing to mention. I recently had an acute mental health crisis on Friday, and I ran. This is a very nice thing to actually. I utilised the NHS local mental health support, and it was outstanding response, and I'm very, privileged and lucky to have NHS. So thank you.
Thanks, Sarah. Thank you for sharing that, and I'm really glad to hear that you had such a positive experience. Thank you for that. Does anyone else have any more questions or comments? Anything to add?
Hello.
Hello.
Is that Angela?
Hi, Angela. Sorry, I couldn't.
I was just saying, it's nice that everyone's remembering people's mental health. But I also work in a hostel, and we had to self-isolate our 7 residents. Some of them got mental health, but also there's people giving up drinking, addiction. And again, that's a struggle for a lot of people, and there's not a lot of support at the moment because everything is online and the services are not available. So I think sometimes we need to remember people with addiction, whether it's drink, drugs, gambling, whatever kind of addiction, they're struggling as well with this self-isolation and things not available because lots of services are closed at the moment with the drug and alcohol services. There's a lot doing it on Zoom or phone call, and a lot of clients, they don't have access to internet. So when we're doing things as well, it'd be nice to remember people with addiction, because I think they're being missed out a lot. And also with the vaccine as well, with the homeless people. I also work in the homeless sector as well with the vaccine.
Thanks for that, Angela. Yeah, perhaps we can have a conversation as well outside of this group to see how we can support you in liaising with services for some of your clients. Barry, your hand is up.
Thanks, Ian. I was going to ask Mohan a question, if that's okay.
Yeah.
Mohan, if anybody has any concerns about their health and well-being, bearing in mind we've heard a lot about the NHS is under pressure, what should they do?
So, yeah, good question. So I think it's, if it's, contact your GP, certainly if it's at the point where you need to get some support and it's got to a point where we're at crisis, and certainly we can help support navigate. We've got plenty of resources in primary care. Got social prescribers, now looking at health wellbeing coaches. You obviously got the community supports as well, so One New Merton, IAPT as well. So there's lots of resources to try and develop that, and certainly, you know, we can share some links on those. I actually also wonder whether, I mean, just listen to the last person who spoke there. I mean, this pandemic's awful, isn't it? And it's doing things against what we all want to naturally do. And actually being as community champions, whether there's a role for you guys and volunteers as well, to kind of really integrate with our community and check in on our neighbours and check in on who we've got around us, to try and find out whether they do need any help and support, and sort of pass that through the appropriate channels. And I don't think there's any one right way of doing it. I think it's all of our combined responsibility. And I think rather than think someone's going to sort me out, someone's going to sort them out, it's all of us trying to empower each other and build our resilience together. So I think it's a multi sort of approach, Barry, and really kind of collecting on what resources we have. And, you know, everyone's responded really, really well, and we all have pulled together. So I think it's, you know, using what resources we do have and using what community resource we have to kind of tackle it together. Thank you.
Thanks, Mohan. Maria, I saw your hand is up.
Oh, I was just going to echo what you said about the community. For example, our street set up a WhatsApp group, and they've started a book club, and they've started other things for some of the residents that aren't able to get out and about, and some of the younger people help. So, and there's also another street behind it that's doing similar things with shopping and pharmacy prescription collections, etc. So there's a lot to be done locally, but that was just something our street set up because we've got a big community of elderly that won't be able to get out. So yeah, just a few ideas there.
And that's really warming to hear that. I mean, that I've got a big. We've got a saying which started here in Merton, which don't medicalise, socialise, and you know, it's difficult in these times because we're not allowed to go out and, you know, see everyone. But actually, you know, that's so simple, isn't it? Your street, WhatsApp, you know, that's one street. I don't know how many streets there are in Merton. You know, maybe 1,000. You know, if every street did that, you've suddenly got yourself a nice community supporting each other, and actually, then, you know, when COVID does clear off, you've actually got something which is a legacy which you can then develop and really make our communities much tighter. So that's a really, really good example of what we can do. I think rather than looking outwards saying, look, what can someone else do, what can we do ourselves, and what can our neighbours do? So it's really nice to hear that. Thank you.
Thanks, Maria. Logie, your hand is up.
Yeah, I just want to agree with Sarah, but down my street, I've got 40 residents on a WhatsApp club. We communicate virtually every day now. We help each other. That's a brilliant. It's going for around a year now. It's really, really good. Coming good. Yeah.
Excellent. Really good.
Thanks for that, Logie. And as well, just to update before we go.
Sorry, can I just say? So maybe we should ask which streets haven't got a WhatsApp group, and maybe we should get them to then set one up, because I think there's great benefit there. So that could be a potential, couldn't it? Maybe on Nextdoor or the Merton Mutual Aid. But anyway, just an idea.
No, that's a great idea. Some homework for our champions this week. Anyone who doesn't have a WhatsApp group. Excellent. Do we have any more questions? Just looking in the chat or hands up. No more hands up. Sorry. I don't think we have any more questions. Just a couple of updates. We do have quite a few webinars on the vaccine this week. We have one this evening that's being hosted by the Medical Association of Nigerians across Great Britain. And it's on COVID vaccination facts and fiction, and that's at 7 p.m. So if anyone would like the invite to that or the details, just send me an email. Tomorrow as well, the NHS Muslim Network is hosting a COVID-19 vaccination webinar, and it's repeated again on the 2nd of February. So again, if you'd like the information to that, just send me an email. And on Sunday, Health Watch Merton are hosting a COVID-19 vaccination webinar with Dr. Mohan. And I can share the invite with you when I get it today. So I'll send an email and I'll also put it in the WhatsApp group. But that's at 5:30 on Sunday evening, if anyone would like to attend. So let's see if I can just get our presentation back up before we go. So next steps. Oh, Mohan, your hand is up. Oh,
Sorry.
no, it's okay. So our next steps, we will continue to answer your questions and use the feedback to develop the network. We've had some really great questions today. I'll pull them together and share them with you all on Friday. If you have any questions in the meantime, please do get in touch. You can email me, or if it's in the WhatsApp group, pop it in there. Our next drop-in session is the 3rd of February, same time, so 12 to 1 and 7 to 8. If you do have any comments on future themes or suggestions for future themes, please do send me an email. We'll be putting together the next few weeks and what we can discuss. We just ask that you share the key messages with your network. If you know of anyone who you think might be interested in joining the network, please do send them our way. If you haven't already, could you please register with the register using the link on the screen, just to ensure that you receive all of the links to access to drop-in sessions and the weekly emails. Thank you all for joining us today. Thank you very much, Mohan and Toby, for providing us with those really informative updates. Thank you all. Have a good afternoon.
Thank you.
Thanks, everybody. Bye now.
Thank you, everyone. Bye.
Thanks. Thank you.